Most of us have had to deal with painful menstrual periods, but not many of us took the time to find out whether the underlying cause is a condition called endometriosis. Endometriosis is when the tissue that makes up the lining of the womb is present on other organs inside your body. Endometriosis is usually found in the lower abdomen or pelvis, but can appear anywhere in the body. In my interview with gynecologist Dr. Ademola Biala, he explained the common symptoms persons with endometriosis may encounter. He also highlighted the fact that this condition is treatable. But when it comes to achieving a cure, Dr. Biala said it all depends on the person's age. Access Health GY starts now.
Most women that have endometriosis actually get their condition stumbled on incidentally by a generalist, a physician. The symptoms are usually non-specific, so they have painful periods, which some women would ascribe to normal things that happen when they start ovulating and start menstruating. Some women would have their periods being slightly heavier than expected. As the disease gets worse, most times in North America and even in the Caribbean, including our environment, most of the women that have symptoms present in the mid-20s. And the symptoms are usually those of severe abdominal pain, which has been persistent for a long time, what the physician would call chronic pelvic pain, inability to get pregnant, and painful sexual activity. Those are some of the commonest reasons why women present to the gynecologist when they have endometriosis.
Is this a treatable condition?
Endometriosis is absolutely treatable. In terms of achieving cure, it depends on the age and the wishes of the patient, but the symptoms can be treated. Painful periods can be treated, painful intercourse can be treated. Sometimes there's pain on passing urine and bloody urine. Those can be attempted to be treated as well. So yes, it's treatable, but achieving a cure is another story altogether. It can be cured only when the woman reaches menopause naturally, or if the doctor decides along with the woman to create a state of menopause in that woman.
Is there a surgical treatment for this condition?
Yes, so surgically, endometriotic lesions can be approached using surgery. Either you can use a pinhole surgery or the woman can be opened fully. The advantages of surgery in endometriosis management is that it helps you make a definitive diagnosis. In our practice in GPHC here, you will have an average of 4 to 5 years between suspicion of endometriosis and actual diagnosis of endometriosis using surgery. So during surgery, we can actually burn off the endometriotic cells that are not supposed to be in the abdomen. You can also use surgery to find out if there are other things that may be contributing to the pain in these women. For those that have completed their families or do not wish to be pregnant at all, surgery is the way to go, and the uterus and the ovaries can be removed. In this instance, that means that the disease can be cured technically.
So you're basically saying that there's no chance of a woman conceiving after she would have opted for a surgical treatment to this condition?
No, that's not true. Most women that have endometriosis will get pregnant. Several studies which are done in North America, and Guyana will soon have its own public studies too. 4 out of every 5 women that present with presumed endometriosis eventually do conceive, and the diagnosis may never be made because there are no surgical procedures done to actually take out the tissue for testing. Having said that, there are those that have very severe disease that fall into the probably 25 to 30% that will have challenges getting pregnant. They can get pregnant, but it may be very challenging, and some do not get pregnant at all.
And this is after the surgery?
So surgical removal of endometriotic tissue can help relieve symptoms. In terms of fertility, there are several other factors. Because the endometrial tissue is growing inside the abdomen, not inside the womb, it can cause clumping, what we call adhesions of tissues together, and that may affect fertility altogether. So surgery is not an absolute definite solution to the problem of fertility, but it's a work in progress towards getting the woman to get pregnant.
When we return, Dr. Biala talks about the need for research in this area, and 2 celebrities share their story.